Hello, we're back here again for the live today. I'm excited to get to some questions and get everything answered for you. You know, as we get started, I really want to start getting into the content from the book. And I am just so excited about it. But honestly, I've had a little bit of a struggle trying to figure out how to simply explain it without going into a long explanation, doing it in a short little bit that we can do on a live. And the way I've decided I really want to start introducing you to this is by using very real life examples. So I just came home with a cold from a trip last week, and I've been so annoyed because I just can't seem to stay well. And I do so many things right. I work so hard at this, and this is the same story I hear from so many of you. I do everything right. Why am I still struggling? So, in the book, what I really help you understand is that really, if you can keep one cell well, you can keep every cell well. And what does one cell require? One cell requires four different things. So there's four things we're always going to talk about. It requires certain supplies, certain support, some things that can help with security, so protection for that cell, and then signaling, ways that the cells communicate with one another. So I started thinking about this. I thought, Michelle, you know this answer. You know how to take care of yourself. So I've created what are called cell well formulas. And these are ways that you can take information and utilize it in any different sort of situation. So let's take it's fall and a whole bunch of people are getting sick right now situation. What do? Well, we need to think about our cells in those four different categories. So first of all, what do cells need to stay well? What do all of our respiratory cells, all these cells need to stay well? Well, they need extra energy. And this might sound a little weird. Extra energy, what does that mean? Well, we always say at this time of year, you should take vitamin C, correct? Well, do you know what vitamin C actually is? It's called an antioxidant. And what that does is it donates electrons. So it gives more energy to your cells. So when I say your cells need extra energy, they need things like a vitamin C that can donate energy to each of our cells. So vitamin C is absolutely something that each person should be taking right now if they want to avoid the cold and flu season, right? So that's the supply piece. The support piece. Well, what do cells need from a support standpoint? Well, there's a wonderful thing called elderberry. And elderberry is not what you're going to take once you're already sick. You can, but it's really useful before you're sick because it's going to support your cells and give them what they need to stay well. So, vitamin C and elderberry, we now have the supply, we now have the support piece. Security, what is that all about? Well, security means we've got to protect ourselves from the bugs that are flying around this time of year, right? So a really great antimicrobial and protectant is oregano oil. So oregano oil can be taken, you can take it just straight, but it burns like crazy. So I do not recommend it. I recommend it actually in capsules. You can get oregano oil capsules. It is going to secure your cells or protect you from all the bugs that are flying around. So again, we have vitamin C for supplies. We have elderberry for support. We have oregano for security. Now, the fourth thing is signaling. What is signaling exactly? Well, that's our cells talking to one another. So let's say one of our cells encounters a bug and it says, oh no, there's a bug in my system. Okay, all of you other immune cells, all of you out there, let's get together, let's rally around this and let's kill this bug. So we need to be able to the cells need to be able to signal each other to be able to say, hey, something's going on. Let's get together and tackle this. So the good news is that one of those three things we've already talked about will supply that signaling, that vitamin C, because remember those electrons? Those electrons are often the signals that these cells require, the way they communicate with one another. So we can cover all four categories of cell need with those three products. So right now, this time of year, myself, you, everybody, if we want to stay well, we need to be doing vitamin C. And preferably something called the lipospheric version of it. What that is it is a more absorbable version of vitamin C, or even better, an orange, an apple, strawberries, broccoli, these all have vitamin C in them. So berries are fabulous for this. Let's eat a lot of vitamin C. Remember, what is vitamin C giving us? It's giving us energy. It's giving us electrons. It's giving our cells the ability to fight. So we need the vitamin C. Elderberry can be taken in a lot of different ways. My favorite formula or favorite way to do it is an actual elderberry syrup. You can buy these. You can actually get kits online to make them yourself. You just boil the dried elderberries. You add some honey to it. Sometimes you can add some spice like cinnamon and clove, make it taste delicious, and honey. And then you take the syrup, or you buy it pre-made. On our site, we have elderberry that's just straight elderberry. We have elderberry plus immune, which actually adds some cool things. It has rose hips in it, which are full of vitamin C. Funny about that. It also has raspberry leaf, which helps with your immune system, and it has echinacea, which helps with your immune system. So we have raspberry plus immune. Go check that one out. We also have raspberry plus, excuse me, not raspberry, elderberry plus energy, natural energy, no caffeine, and elderberry plus inflammation. So go check all those out. We actually have some elderberry teas on there as well that are really great. So elderberry, this time of year, that's going to provide the support you need. And then the oregano oil to provide the security to fight the bugs as they come along. If you do those three things, like I said, this is called a cell well formula. If you do those three things, most likely you're going to avoid much of what's happening and flying around this time of year. So just want to start introducing these concepts and these ideas and ways to keep ourselves well using the earth, using the products that the earth has provided for us. And all those things are vitamin C, elderberry, oregano, all of those grow right out, literally right out my door right here. And it's what is available for our bodies to use. And so I'm just going to start teaching and training and showing you how this whole concept works as we go along. So keep coming back and check out all the content online and places, because I'm going to be sharing a lot of free information on how to stay well, and how to return to wellness. Okay, let's get to some of your questions here. Do you advise people to take a round of antibiotics when doing tooth extractions and cavitation cleanup surgery? My biologic dentist is recommending antibiotics, but I trust your opinion more. Well, I'm glad that you trust my opinion. Thank you. So here's the deal with antibiotics. They work, right? They fight bugs. However, they fight all bugs. So they fight the bugs in your gut as well. An antibiotic, biotic means life. So if you have an antibiotic, you have an anti-life. It's actually going to kill something that's alive. So it's going to kill all the good bugs in your gut as well as the bad bugs that you want to kill. Sometimes it's a compromise we have to make because we have to stay alive. Sometimes there's just those situations where it's a compromise you have to make. And sometimes in a really infected tooth, we're going to make that compromise because that infection spreads. And when it spreads down here, it spreads into the respiratory area. When it spreads up here, it gets into the brain. So this is not an infection that you want to fool around with. However, we do have an alternative. We have a couple of alternatives. And again, it's sometimes based a little on the severity of the infection that we're talking about. So the two options that we do is we will offer antibiotic through an IV. If you're going to do the antibiotic through the IV, you need probably 5 IVs and sequentially, like one a day, to be able to get the same amount of antibiotic efficacy as you're going to get from taking a pill. So the reason that that's advantageous is because it goes through your bloodstream. Now you still have bloodstream that gets to your stomach. So there may be some antibiotic activity in the stomach, but it's going to be much reduced from actually just putting the antibiotic in your stomach, taking it through the mouth. So much reduced. You don't have the GI effect, the gut effect, when you're taking it through an IV. So that is an option. If somebody says, absolutely, I will not take an oral antibiotic, my gut. I've had patients that say, I had C. diff and some of these really horrible infections that were post-antibiotic usage. And they say, I just won't do it. Great. We have an option. Let's do it through the IV instead. So we can absolutely do that. A second one that I do for people that have maybe a lower grade infection is there's actually a homeopathy or homeopathic antibiotic that I recommend called Notosan. And I love it. And I'll often piggyback that with other things. So we'll add that to like oil of oregano. Again, that's a broad spectrum antimicrobial, some colloidal silver, some other things that are going to really naturally help to fight bugs. And this will help as well. So a couple of different options. If you have to do the oral antibiotic, well, then what do? We start loading up the probiotics. So you're going to go get my gut health and my gut rebuild, and you're going to take that for the next couple of months after the antibiotic to see if you can rebuild what was destroyed through that antibiotic usage. Okay, I did a cone beam CT scan. I have 2 infected root canals and 4 cavitation sites. My gut is a mess. All my teeth are pre-cavity stage. Should I get my gut healed first before surgery? I'm afraid I won't heal well. That's actually a really good thought. I just had this conversation this morning. A friend of mine, her father had a horrible accident this week. He hit a deer riding a Harley Davidson motorcycle, flew over the deer and broke bones, beat up head to toe. Anyway, I was just asking her today how he was doing. And she said, he overdid it on Tuesday. And so he slept all day yesterday. And my comment to her was, we all underestimate the amount of energy it takes to heal. So this is something I really reinforce to patients all the time, is that to stay well, our body requires a certain level of energy. And when I talk about energy, I'm literally talking about chemical energy, like electrons that come from food, that come from supplements, that come from these things. We need a certain amount of this. It also comes from the earth. Just a side note, electrons also come from the earth. So we need a certain amount of this electricity for our bodies to be able to do the work they need to be able to heal. So when you're sick, you are already down here. Well, when you are working to heal, you need more than normal. So you now go into surgery, you're already depleted, you already have less energy than it even takes to stay well. How do you expect to heal very well? Does that make sense? It's really not going to work very well. So I absolutely recommend healing the gut. But here's a little quick tip and quick how do you fix this issue really quickly is if you start taking HCl digest, which is hydrochloric acid, you start taking that along with the supplements, you are going to absorb that supplement. Even if your gut is very ineffective in absorbing, you need to do some work to heal it, but that might take months. If you take the HCl along with it, you're going to be able to absorb it better. So you take the HCl along with your vitamin C, your oregano oil, your elderberry, the things I just talked about, those all get you stronger, as well as turmeric and ginger and things that help with liver and detoxification. You take that HCl along with it, and you're going to get those things in better and faster and more efficiently. So you're going to work to build yourself up. You need omega-3s. I mean, if you go on my Total Care Dental site, you're going to see we have a pre-surgery supplement kit. You need everything in there. You need to do that built up at least 30 days ahead of time. You need vitamin D, vitamin K. I have good news on vitamin D and K. Actually, we have an amazing sale coming up real soon because vitamin D and K are absolutely essential for staying well this time of year too. But so you need these things to be able to get your body built up just to normal. And then you need to super supplement after surgery. So you're going to take more than you're going to take to stay well. Because you have to return to wellness at that point. So you're going to super supplement after surgery. You absolutely need to do some of this before you're going to get going. If your teeth are all pre-cavity, that means you're not absorbing nutrients. Yep, you got to get your gut going. Absolutely. You are thinking correctly. This is an interesting question. If I'm nutrient deficient, will my platelet-rich basically in our office is platelet-rich fibrin, still be able to help me heal just the same? Yes, because that it's basically, I like to think of it as stem cells and growth factors. Those aren't necessarily affected by nutrients. So nutrient levels in your body are all affected. Existing cells are affected, but stem cells are brand new cells. They're baby cells. And those aren't necessarily affected by nutrients until they start to grow. Then they need the nutrients to do the work. So you're still going to be okay. But that building up to supplements and super supplementing after is going to be really important. If I get my infected root canal removed and I don't have the money to do an implant, how will things be affected? So I tell people this all the time, get the tooth out, because that's what's affecting you the most is that infection. Get the tooth out, wait to get the tooth replaced if you need to. And you can do things like a little retainer that has a tooth on it temporarily. How does that affect the body? Well, the cool thing about the way the body is connected head to toe electrically is that typically two teeth are on one circuit. So if you get both of those teeth removed, sometimes it will short that circuit a little, but if you have one adjacent tooth still there, you still have that circuit live. Okay, what are my views on zirconia crowns? I was told by my dentist that I need to replace an old crown. Okay, so zirconia is incredibly strong. You've probably all heard of zirconia, cubic zirconia rings, right? And that they look very similar to diamond. In fact, they're even harder. They're so hard. Cubic zirconia and zirconium and diamond are some of the hardest substances on the planet. The problem with zirconia in the past is that it's actually been kind of hard on the tooth that chews against it. So you make a crown out of zirconia, out of this really hard material, and it beats up the tooth that's chewing on it just a little bit because the tooth is softer than the zirconia is. But they have improved this. They typically put a softer layer on the outside. They changed the structure of it just a little bit. So it's going to be kinder. The other issue in the past is that we haven't had good cements, and zirconia has a hard time of staying on. But now that's all been improved as well. So honestly, today, I would say at least 50% of crowns are all zirconia now. So that's a fine material. Help with dry mouth. Help with dry mouth due to menopause, please. Such a struggle, isn't it? Menopause is throwing all those hormones off. Not only are you getting dry mouth, but you're getting a reversal of fluid flow in the teeth because your body needs those nutrients in the body. And so it's going to take them from your teeth. So you're going to do a couple of things. For sure, for the dry mouth, one of the things you're going to do is the mouthwash and the breath spray. Carry the breath spray everywhere. Not only is it going to fight decay and other issues that are going to be caused by the dry mouth, but it also has marshmallow root in it. Marshmallow root is an herb. Literally, I've got it growing right out here, right in front of me. Marshmallow root is an herb, but it's called a mucilage, or it stimulates saliva. So you're going to want to use that breath spray all the time to help stimulate saliva, but also protect your mouth. It has colloidal silver, but also has hydroxyapatite. So it's going to add minerals back in if your body is stealing them. The other thing that I want you to do is I want you to start adding more to the inside. So you're going to do vitamin D3 and K2, as well as the tooth and bone formula. Why? Because part of that dry mouth is, again, the body's reversing flow to the inside of the mouth and pulling it in rather than leaving it out. You want to have enough in the body that it won't do that, that it's not going to pull it from the inside, from the outside in. So tooth and bone formula, vitamin D3, K2. Like I said, we're going to be having a sale real soon on that D3, K2. So watch for that. Okay, I've been having difficulty with an osteogen plug. It's been 2 months now. Can I take it out and replace it with PRF? Have you heard of that? So an osteogen plug is most likely I'm not actually familiar with that exact brand, but it's probably a collagen plug. If it's not integrated after 2 months, it's not going to integrate. So you need to get that out. You need to freshen it up. You need to add some PRF in that area, perhaps a bone graft in that area to be able to actually do the job. Okay, I just answered that again. Why can't infected teeth roots be healed, say using antibiotics or ozone? Great question. All right, so I'm going to use another example to help explain this one. Let's say that you have an infected appendix. All right, so when I was 16, I think I was 15 or 16, I was at a music camp, and I started getting really bad stomach ache, really bad stomach ache. I started throwing up all the time. And this was a big bummer because I wanted to be at the camp. I wanted to be doing all the things with these new friends that I just made. And I was sick in my dorm room, just throwing my guts up. And that evening, it was not getting better. So they finally took me to the student health center and they said, I think this is an appendicitis. They sent me to the hospital in town. And sure enough, they said, you got to have your appendix out tonight. I was without my mom. I mean, my mom wasn't there. They called my mom. They got approval. She said she cried as she drove to try to get to me, but she didn't get there before I went in for surgery. I mean, it was very traumatic. But let's say that in that instance, they took that appendix out of me. They cleaned it up and they put it back in. They didn't do that, right? In my situation, they didn't do that. Why would they not do that? Because that appendix is now completely removed from blood supply, from nerves, from all of those things. So the body's immune system couldn't get to it to fight any bacteria. And dead stuff always attracts bugs. So guaranteed, if they shove that appendix back in there, it would be infected within days again. So that's the problem with tooth roots. Once they are dead, so once the tooth is actually infected and the tooth has died, what that means is the nerve tissue inside of that tooth is no longer conducting. The blood flow is no longer flowing. That is all dead tissue inside of there. When, let's say you take an antibiotic. All right, great. Take an antibiotic. There's no blood flow to the infected part of the tooth. Remember, that's part of the dead part. There's no blood flow there anymore. So there's no way the antibiotic is going to be able to get there. Ozone, same thing. Ozone will treat bugs in the area. Great. Takes care of it for about 5 days. And then the bugs are going to find the dead stuff again. So the key is the dead stuff. As long as something dead is there, the body cannot take care of it long term. It's going to try its hardest. It's going to send all of its immune soldiers there. It's going to get inflamed. Sometimes it'll hurt. Sometimes it won't because the nerve's gone. It's dead. It's going to start doing all the things it needs to do. And unfortunately, that leaves your immune system very distracted for taking care of other problems elsewhere. So this is why dental infection leads to other health concerns. So it can't be healed with antibiotics or ozone because it's the dead stuff that's the problem. We've got to get the dead stuff out to be able to make it so the infection stays away. How often do we want to replace a night guard? What material do we suggest that it should be made of? So this is a little bit of a trick question here because a night guard it's a Band-Aid. A night guard doesn't fix anything. A night guard may protect your teeth from grinding or clenching. but it doesn't solve the grinding or clenching. So that's my answer first is find out why you're needing the night guard. What's all that about? Usually it's an airway issue. Find that out, fix that, and then you don't need to wear a night guard. So I actually haven't prescribed a night guard in probably 5 years. Okay, I keep hearing about, let's see, how much oregano oil do we take? Drop, teaspoon, etc. Okay, so I'd said with oregano oil, if you're just going to take it straight, it's going to burn. And I'm talking burn. It'll like burn the inside of your mouth off. So I don't recommend doing that. So if you're going to do oregano oil, a little goes a long way with oregano oil. If you're going to do your own capsules, I'd put a couple drops in a capsule and take it. And that's about all you're going to need. If you go to a store and get oregano oil capsules, they're going to have a carrier oil in there along with oregano oil. It won't all be oregano oil. So it'll be one capsule. It's already prepared and ready for you to go. Great question. What does it mean if your mouth feels more watery, like more saliva? Great question. So sometimes this just means that there's something in there that's creating that salivary action. Sometimes it means that your body's own kind of salivary producing mechanisms are turned on. This is part of your autonomic immune system, basically the way the body's responding to things. So what I again recommend is mouthwash. Use that. Let's see if that marshmallow root can't just calm down that salivary production a little bit, freshen things up, get some hydroxyapatite in there. That's what I would do first. I'll be having a crown placed in my mouth and I will ask, okay, with my holistic, perfect. When I do get my gut starting to heal and I decide to do the surgery, should I do the 2 tooth extractions and 4 cavitation cleanups all at one time or split it up? I actually prefer to do it all at one time. The reason I prefer it that way is because you're going to be going through surgery. Your body is already going to be needing a lot. It's already going to be depressed. It's not really going to need much to do all of it, then some of it. And so this is going to make it so you have to super supplement for a little while, but it's not prolonged. Otherwise, you're just going to drag this out for months and months and months. Okay, I'm going to jump. Oh, this is a little bit of follow-up. Is it possible for only part of a root to be infected? I have sensitivity near the outside edge, but I failed the cold test. And my dentist said I don't even have a cavity. So that's a very interesting situation. If there's no cold test, it means you're not feeling it at all, but you have sensitivity. That's a little bit of a differing thing, right? You feel it a little bit, but then you don't feel much of anything. So, the key is the tooth alive or not? And so I would do what's called an electric pulp test to determine, is it alive? Sometimes it is partly dead. I know that's a crazy thought, but sometimes it is, but then it's on its way to gone. Okay, I'm going to jump over here and do a few of these. What is involved in packing stem cells into cavitations? All right, so let's just talk about this a bit. When we talk about stem cells, we're not talking the same kind that you're going to get injected into your knee. There's different kinds. We are going to use, it's called platelet-rich fibrin. The abbreviation is PRF. And the way it works is we draw your blood. We have a special centrifuge and a special tube that it's in, and it spins it in a certain way to separate out different components of the blood. So we get the red blood cells at the top, we get the serum, so it's like the liquidy part, and then we get something that has all of the fibrin in it, which is kind of the mesh-like stuff in our blood, the fibrin, the stem cells, the growth factors, that all then gets into another part. So you get the red stuff, the liquidy stuff, and then the thicker stuff. So we take off that thicker stuff, and that is the part that we want to save. We actually put it on a special kind of like a metal pad, and we squish it. I know this sounds weird, but we squish it flat. It pushes the rest of the liquidy stuff out and just leaves kind of that mesh work there, that meshy stuff there. So we can pick this up and wiggle it around. It's kind of the best equivalent is kind of looks a little bit like snot. It's a little bit what it looks like. So like some thick snot. And so that is what we use to put into these extraction areas. So when we take a tooth out, when we clean out a jawbone area that hasn't healed right, all of those things, that's when we're going to use this PRF material. And why? Well, when your body has to heal a great big hole, the problem is that it has to start to fill it all in, and it fills it all in from the bottom up. And sometimes there's not enough for it to be able to actually build upon to fill all the way up in that hole. So we add the PRF in there to act like a scaffolding. So now the scaffolding, your own bone cells can grow in and amongst all of these PRF. The stem cells will stimulate the body. And what stem cells do, they're very fascinating, actually. what they do is wherever they're put, they're an undifferentiated cell. What that means is they're a cell that doesn't have a job yet, that doesn't have a specific purpose yet. Wherever they're put, they take on the purpose of the place they are. So if they're put in an area in a jawbone, they go, oh, I'm supposed to be a bone cell. And then they start to form into a bone cell. It's pretty cool. So we have those in there. So we already have the precursors for bone cells. We also have growth factor. So what it's going to do is it's just going to delay the drip of this growth factor down to say, okay, here's what you need to grow. Here's what you need to grow. So your own bone cells plus these stem cells that are turning into bone cells, growing on the scaffolding of fibrin, allow for that bone to fill the hole much faster and much more predictably. So that's the key in these stem cells. So it's, again, kind of a snot-like material we're shoving down into the holes. Sometimes we'll add bone graft material with it. And that's what then your body heals to. It just allows for better healing. My dentist is pushing me to get a root canal. What do you recommend instead of a root canal? So I answer this question so much. Please go online, check out the information about root canals. But in essence, I recommend removing and replacing the tooth. That's what I recommend. And a ceramic dental implant as the replacement. Are you familiar with oral lichen planus? I have an old root canal and a tooth that needs a root canal, even though I do not have any pain. I had a biopsy of a cheek that came back as an OLP. So oral lichen planus is an autoimmune condition. And anytime you have an autoimmune condition, I'm always looking for the source of immune distress. That old root canal, and if that tooth that needs a root canal, which I'll never say, remember, you never need a root canal because you can take the tooth out. That tooth, they may be the reason that your immune system is all distracted fighting that and not able to take care of your own body. So get the infection out, and most likely the lichen planus goes away. I have pain and sensitivity in the tooth with a crown. What are my options for this? Well, the key is to figure out what is the pain and sensitivity from. And is it pain? Is it sensitive? Sometimes they're different. So sensitivity means hot and cold. That's great because the tooth's still alive. So hot and cold. Is there a leak around the crown? Is there some place that needs to get sealed better? Did it get a little air bubble underneath it that's creating compression and making it hurt? All those things. That's one possibility. Number two, does it hurt just to bite on? It just hurts when I bite. Okay, it might just be a little too tall. They might just need to adjust it down just a little bit. That's the second option. Or no, it hurts down on my jaw. It hurts every time I bite on it. My whole face hurts. Most likely the tooth has died. And if that's the situation, it's a whole different story. In that case, it's either a root canal or remove and replace the tooth. So you have to decide, you have to figure out which one is this. Just a cold sensitivity, it's a leak, it's a, something needs to be sealed. Is it a biting sensitivity? I need to adjust. Or is this an achy, sore in my jaw, dead tooth? Different story. Okay, I've got 3 minutes left. I've got another live I've got to jump onto with somebody else here in just a second. What can cause bad breath or a bad smell with flossing between certain teeth? But there's no apparent swelling or redness to indicate an infection. So bad breath or bad smell can often just be because plaque's building up there. So oftentimes what I recommend is using floss, very good there, very well there, but then also using something called a proxy brush, or you're going to find these like a go-between, a little pick, interproximal pick. You're going to find all of these things at like a Walgreens. So you're going to go find something that'll go right into that space, but carry some things with it. You're going to put my mouthwash on that, which is colloidal silver. It's going to kill bugs, but it's also herbs for inflammation. There is lavender in there. There's plantain in there. These are all very good for decreasing inflammation. You're going to put that on this little Christmas tree brush looking thing and put it right into that spot. Basically, you're medicating that area now. So you're flossing, you're cleaning out any gut, bugs, gunk, whatever needs to get out of there. And then you're medicating the area. Do that twice a day. After you brush and rinse, then go back in, add a little bit more, and see if you can't get rid of that. Because sometimes it's just a buildup of plaque, or a buildup of bacteria, but not necessarily to the infection stage. All right, one more. I had COVID and suddenly I had a reaction to all my titanium implants. I'm taking them all out now and the bleeding in my mouth has improved. Any advice? So this is so fascinating to me. This really exemplifies the interconnectedness with all of our systems. And if our body is fighting something like COVID, anything, then it doesn't have the defenses and needs to deal with other stuff, right? You know how this works. You've been sick. All of a sudden, your kid's screaming. And you're like, I can't handle it today. Why? Because you simply can't handle it today. You don't have enough reserve to deal with everything coming along. So most likely that's what happened. Your body had been dealing with the titanium for a long time, and it could do it as long as there wasn't something else taking its attention and reserves. But once something else came along, they can't do it anymore. So what that shows is you were really kind of on this teeter-totter and really close to tipping the scale already. So good job taking them out. Okay, such good conversation. I love these questions. I love the depth we're getting into things. I hope this is helping you all. Thank you so much for being here, for joining in. Go online. I've got answers to so many of these questions on there. Go online, watch some reels, check it out, and I'll be back next week. And go check out, I'm on the Forever Young podcast live right now too. So you can go check that out too. Thank you all.